The main conclusion of the second year follow-up is very similar to what we had last year. That is to say, we have no difference between the groups if you look at the intention to treat endpoint, but also in per protocol analysis, in any subgroup analysis, but this concerns the pre-specified endpoint. Well, we have one signal which is interesting to consider is that during the second year of follow-up, if you just isolate the second year, during this period, we had less rehospitalization for heart failure in the group who received the clip. So it's a signal. We have to be very cautious because it is a non-pre-specified endpoint, but it is interesting to consider. Well, the first lesson of those two studies is that we have to get a very accurate medical treatment before considering to clip the patient or not. And if the patient is still symptomatic, then you can consider the clip if the regurgitation is still severe and also if the patient is still symptomatic, of course, with ventricles which are not too much dilated. This is probably the good indication for the clip, but this is probably a very narrow population of our heart failure patients. The first step is to treat correctly the patient, and then we have to look at the echo at baseline, and this is not easy. You need a core lab which is very used to deal with those patients, the specified heart team who is used to treat heart failure patients. And on the echo, you have to consider the size of ventricle and also the severity of the regurgitation. And you know that now there is this new concept of proportionate MR, which makes sense because we can interpret the severity of the regurgitation considering the severity of the ventricular disease, because we need to better define what is a secondary MR. And you know that in the past, the definition in the European guideline was not the same as in the US guidelines. And we have learned that we have to better identify those patients today, and therefore we can consider the best patient, probably a very narrow population who could really benefit from the MitraClip.